Now, Dr. Pena, I know you're on our 3D image wall and you have an artery. Tell me what's going on here and relate it back to that P.A.D. that we're talking about.
Sure, Olga. What we see here is a model artery, and you can see the artery with the different layers, and running through the artery we see the blood cells and the platelets that we have normally running down the artery. And what you see here is this yellow substance is when we talk about plaque or atherosclerosis. And that atherosclerosis can start developing there in the artery and start narrowing the artery. So as you can imagine, as this becomes narrow, you can start getting less blood flow down to that specific leg or down to that extremity as the blood is bringing nutrients down.
And Dr. Pena, as that builds up, then what happens?
And then as that builds up over time, it can get to a critical point where now you may not be getting enough blood to that specific extremity, and then that's when symptoms may develop. That's when we start going through what we just talked about in terms of claudication, and then inevitably you may have to end up with critical limb ischemia. Having this type of process, especially when it is subclinical, in other words, you have that plaque, we have some narrowing, but it's not really giving you symptoms, or it may be giving you mild symptoms. It may be something that's difficult to point out and say, this is truly what's going on in the artery.